I've been here at Englewood Health for 21 years in the IT department, and there's always a new challenge every day. I love working with all my users and all the hard work. You know, at the end of the day, there's a patient that you're helping. And it's a lot of job satisfaction. I mean, I think it's great to see more women, especially in the IT field. I think we bring a different perspective. We have a lot of, our relationship skills and empathy.
Kind of just fell into it, and it's been great ever since. It's definitely a new world, a world I wasn't familiar with until I really fell into it, especially healthcare IT. There were actually a decent amount of women when I started IT, which is really nice to see because I didn't think that would be the case. Once I started, I saw that they were not only women on my level, but also women above me.
I started here as a nurse in December 2011. I was a med-surg nurse on one of the floors here at Englewood. I learned a lot. This was my first job as a nurse. And as the years went by, I was trying to figure out what the next step would be for me. And then one day I was exposed to a nursing informatics council where I saw the collaboration between IT and nursing. And that was kind of the thing that made me more interested in what the other side may look like.
A little bit about what I do in IT is I work with the, operational leaders, and I get, all the clinical aspects and their challenges, and, how can we make this better? From the IT perspective, I'm able to spin it and, help them come up with a new workflow or a new way of, getting patients involved or making sure patients come back for their appointments.
Because we work with Epic, there's a lot of end user satisfaction, and I think that's probably the best part. Just like a doctor saying, wow, this really helped, or you just saying, wow, you made my life a lot easier.
So one of the projects that I'm working on right now is eConsents Phase 2 for procedural consents. It's a hospital-wide initiative that is going to cover most of the procedural areas, the emergency department, inpatient, radiology.
The advice I would give the young women is to really go after their dreams. I mean, the new flexibility that IT and other industries have these days has really helped us manage our lives.
Advice that I would give any young woman interested in starting a career in healthcare IT is don't sell yourself short. Very easy with the word IT, information technology. It can sound intimidating and you might think it's not something I can do, but I definitely would say don't sell yourself short.
I think any woman who comes in, they bring in their background experience, whatever they were doing previously, they bring that to the table, and that allows a perspective that sometimes you need those new ideas, you need that fresh perspective. Traditionally, IT is a male-dominated career, but it's not just a man's world anymore. There's room for women. They have a seat at the table here too.